Hi, everyone. Good morning and welcome to day 2 of the 2025 Statewide Collaborative Prevention Convening. My name is Sarah Lacroix, and I'll be your MC for today. When not MCing, I'm a co-lead for the Strategies Technical Assistance Program with All for Kids, which is formerly the Children's Bureau of Southern California, and also the director for the Los Angeles County Child Abuse Prevention Councils. In partnership with the Child Abuse Prevention Center in Sacramento, Strategies TA continues to support prevention collaboratives, child abuse prevention councils, family resource centers, and their networks throughout the state. And we're thrilled to come together with all of you again today to hear from a variety of subject matter experts in the field, and most importantly, support your in-person connections with your CPP teams today, Comprehensive Prevention Planning Team. Excuse me. Before we jump into the content today, I want to again take a moment to thank the 25 plus members of the statewide convening planning team who've been coming together since August of 2024 to make this event happen. This year, we had a robust, diverse, and cross-sector planning team with representation from parents and youth with lived expertise, tribes, various county and state departments, state associations, child abuse prevention councils, and community-based organizations. We sincerely hope the program today is supportive of your efforts to create change, and thank you all for being here. Please note we have ASL interpretation happening. We also have Spanish translation happening through the Spanish translation channel. Message us, please, if you have any questions about that. And we are going to try and slow ourselves down a little bit today to give the ASL interpreters and also the Spanish interpreters enough time to communicate what they need to share. All right, so next slide, please. Just a few housekeeping items today. So because this is such a large capacity webinar, the Zoom chat has been disabled. So please use the Whova chat for comments or any tech-related needs. I know a lot of folks are in person today that might not be the same kind of need as yesterday. The Whova chat's located on the right of your web browser or through the chat button on the mobile app if you're there. Also, if you need tech support at all, please include your request in the chat, the Whova chat, and someone from our tech team will reach out to you. If you have any content-related questions about something the speaker's sharing, please use the Q&A feature on the Zoom toolbar, which is going to be at the bottom of your screen. So just to kind of give you all a little run through of this housekeeping. So the main session of the event is a Zoom webinar, as you see. So you won't be able to turn on your camera or mics. However, the county virtual team sessions you all have are going to be Zoom meetings for those of you who are virtual or hybrid, with the ability for participants to turn on and off your cameras and mics and engage with others. The slide deck and any materials shared today can be found at the Resources tab under Documents, located on the Whova webpage and through the app. Attendees will have access to the materials on Whova 3 months after the event ends. So you have time to go back and watch some of the workshops or some of the main keynotes. The Day 2 facilitation guide will be provided in the chat and can be found in the Resource Hub for site leads and facilitators under the Resource tab. This event is being recorded and will be shared after the event. And we do ask that you please complete the evaluation survey at the end so that you can help our planning for next year. Great. Next slide. Okay, so a little overview of Whova. I know for some folks, might be the first time you're using it if you weren't able to join us yesterday. So keep the browser with the Whova dashboard open throughout the event. This is kind of how you'll access the main session and the different workshop sessions. You'll have different sessions today. If you accidentally exit the browser with the dashboard, just rejoin by going to the website and signing on. So you'll see there's a couple of different functions here: agenda, sessions, chat. That is how you'll kind of navigate and explore some of the different pages. For any tech issues, again, enter in the Whova chat, and you can find documents shared under the event in the Resources tab via Whova. Next slide, please. All right, so similar to last year and to yesterday, in trying our best to remain a trauma-informed event, The planning team decided to offer emotional support through 3 of our wonderful licensed clinicians, who you'll see up on the screen here. That is Jamie Bart, Melissa Corden, and Amy Kay. Amy Kay will be providing support in American Sign Language. She is a longtime partner and as part of the Advocacy Council for Allies of Deaf Children, or ACADC, one of the child abuse prevention councils in Los Angeles, and works for an organization called 5 Acres, which provides specialty mental health in English and Spanish, and also they're the only deaf services program in LA County. They provide therapeutic services in American Sign Language to deaf and hard of hearing children, and have expanded mental health services to include deaf adults to help families stay together and thrive. So lastly, we recognize that many people here have been impacted by trauma and family violence. We really do encourage you to call or text the number here for Victoria. You'll see up on the screen, and she'll be able to connect you to one of the clinicians should any difficult feelings surface for you at any point in the event today. So please take advantage of that if you should find that you need. All right. I am now going to pass to the lovely Andrea Lewis, who will acknowledge some history for us.
Good morning, everyone. I'm coming to you from San Jacinto, Riverside County, from the land of both the Saboba, Luisano, and Cahuilla people. They've lived within these lands for countless generations before the onslaught of colonization. They're like indigenous people across the nation. They experienced genocide, ethnic cleansing, theft of their land, their waters, and forced cohabitation. I want to acknowledge that the ability to live, work, and enjoy this area is connected to their deep loss. We also acknowledge the labor and contributions of diverse communities that have shaped and continue to enrich the United States of America. Among these, we recognize the invaluable contributions of African Americans whose resilience, creativity, and labor have played a pivotal role in shaping the nation's history and identity. From the forced labor endured during slavery to the fight for civil rights and social justice, African Americans have tirelessly contributed to every aspect of American society. Their labor has been foundational in building the economic wealth, cultural vibrancy, and political landscape of this country. Furthermore, we honor the labor and contributions of Indigenous peoples, immigrants, women, and other marginalized communities whose work often goes unrecognized. From the construction of railroads to the cultivation of crops, from the innovation of technology to the enrichment of arts and culture, these diverse voices have been essential in shaping the fabric of America. As we reflect on the past, we commit to acknowledging the ongoing struggles for equality, justice, and fair labor practices, including those with domestic spheres. We recognize that systemic barriers persist and pledge to work towards a future where all individuals are valued, respected, and given equal opportunities to thrive. Let us honor the labor of those who come before us and strive for a more inclusive and equitable society where the contributions of every individual are celebrated and valued. This year's planning team included more lived experts, youth, and diverse partners than ever before. For the past 6 months, the planning team has met at least twice a month to carefully curate content for this 2-day event, ensuring input from all interested stakeholders. We recognize the challenges of crafting relevant and engaging content that reflects the diverse needs of our counties. We recognize the need to include the most impacted by the child welfare system, African American and tribal families, including those with lived experience to be equally and meaningfully involved in prevention work. This means having an active role in decision-making, co-creation, and implementation. As a planning team, we recognize the need to put in more effort to engage disproportionately represented families and those with lived expertise at every stage of the planning process. We hope that local county prevention planning teams will also commit to engaging with disproportionately represented families and those with lived expertise in their prevention work. We encourage you to continue sharing feedback on how the statewide prevention collaborative completing planning team can improve and be more effective in this work. To each of you who played a role in shaping this event, thank you. Your selflessness, passion, connections, and firsthand experiences made it possible for us to bring so many incredible workshops and programs to life over these 2 days. Your voices add depth to our conversations, helped us reach new communities, and made this gathering stronger. Just look around at all the people that we have here today. Your time, energy, and dedication mean the world to us. We truly couldn't do it without you. We are deeply grateful to each and every one of you for being here. Your participation and unwavering commitment to supporting children and families inspire us to keep doing the work. Your presence shows the power of a community that cares, and we are honored to share this journey with you. Thank you for making a difference.
Beautiful.
Mm.
Thank you so much. All right. I'll keep us moving on our purpose for today. And again, I will try to slow myself down so that the interpreters have enough time. So today's purpose is really for everybody here. We really hope for this to be a working convening where you can get some things done with your team. We want to go deeper on community and tribal engagement, sharing and learning from our peers. It's one of the things we hear most, that people really want to hear from others and what they're doing. We hope that today is about deepening relationships among existing team members and welcoming any new members that you might have today. You'll be hearing from some subject matter experts to lend some learning to what you're already accomplishing with your prevention work in your county. All right, if we can please go to the next slide, that'd be great. Thank you. So I'll just cover a little bit of our agenda for today. You'll hear at this point some of the housekeeping and some welcome soon from our convening planning partners. We'll have a keynote presentation by Dr. Bob Sege on the HOPE framework, and he'll be joined by our own Alyssa Burke. We'll then at about 10:30 to 12 have the first team session. So that's where you'll get started and have some activities and things if your group has decided to use the guide, moving from head to heart. We'll have a lunch break from 12 to 1 and come back at 1 o'clock to do some peer sharing with 2 counties that we've been very honored to work with, both El Dorado and Tulare. And then we'll have some instructions for our afternoon session. And then you'll have a little bit more time in the afternoon session thinking about how you might apply HOPE to what you're already doing, maybe planning for some action or charting a course. We'll come back from there and we'll hear from 2 other counties, Santa Clara and Lake. Excited about that. And then we'll do some wrap-up closing and appreciations. All right, next slide, please. Okay, so we recognize people are in person. They're either in a hybrid format or an all virtual format. And so we wanted to ask folks, well, who's in the room today? So you'll see a QR code up on your screen there. And if you can go ahead and scan that, I believe you'll also get a link dropped as well. I think that's going to go into the Whova chat. And if you can please tell us, what is your affinity group? That'll be your first question that comes up. And that might be you're with a Child Abuse Prevention Council, you're with a community-based organization, you're a lived expert, you might be from a state department. Oh, here they come in. Right, child welfare services, a tribe or tribal organization, education, probation, so many wonderful, wonderful partners. And we recognize there are many others here today too, right? So if you selected other, I believe we're asking folks to put into the Whova chat, what's your other affiliation? So we have kind of a bigger understanding of the representation that's here today. Wonderful. See folks coming in, lots of community-based organizations, excited to see that. We have a good representation of child welfare folks, welcome. Educational partners, I see there's a good deal of others, so I'm curious about who's coming in under there. And the Child Abuse Prevention Councils, hello everyone, thank you for being here. All right, so you'll kind of see that representation as it bubbles up on the screen. So continue with that question if you haven't already. And then we're going to ask a second question for folks in the room. so to speak. So whenever you're ready, Nathaniel, we can go to the next one. And this one will continue to populate. All right, now we want to know, what California county are you located in or representing today? So you'll take a minute. I think they should be all listed there within the Mentimeter. Again, same, scan the QR code, or there's a link being dropped in that you can use. Let's see what we got the folks for today. Now I see a lot of Southern California folks. Hello, hello. I believe the LA County group is in person and they're a big group today. Welcome. I see some Northern California, Sacramento. Oh, those little counties are so hard to see, but hello, good morning. Wonderful. We've got about 15 or so statewide folks on. Excellent. Thank you, everyone. So please continue to populate this as well. And that'll help us know kind of, where folks are coming from today and help us understand who's not in the virtual space, but who's in the space. Thank you. All right, next slide. Wonderful. So I have the pleasure of introducing two of our planning partners, Felicia Moore-Herring, who's a health program specialist, and Sarah Betts, Associate Governmental Program Analyst. Both partners are with the Family First Prevention Services Act unit with the California Department of Healthcare Services, or DHCS. So welcome, Felicia and Sarah.
Thank you. Good morning, everyone. I would like to welcome you all again to day 2 of the 2025 Statewide Collaborative Prevention Convening, and extend a thank you to everyone who attended yesterday as well. As Ms. Sarah said, my name is Felicia Moore-Herring, and I work for the Department of Healthcare Services as a health program specialist for the Family First Prevention Services Act, also known as FFPSA. Our unit is responsible for both Part 1 and Part 4 of FFPSA under the mighty direction of our Chief, Tana Kinder. She'll be joining a little bit later today. Personally, being a part of this group and being the lead of the Part 1 prevention projects within our unit, it has been an extensive pleasure learning, observing collaborations, and hearing ideas regarding everything that Part 1 of FFPSA entails from different professional disciplines. The convening planning team consists of such a great group of people who are willing to do everything they can to help. It is often said you define what is important to you by what you dedicate your time to. And I will say a lot of valuable time was dedicated to this convening from the planning team, because everyone on the team believes the content of this convening is extremely important and necessary, especially when public and private partnerships work together. To speak a little more on that, I'm going to hand it off to Sarah Betts, my fellow amazing unit member.
Thanks so much, Felicia. Hi, my name is Sarah Betts, and I'm an Associate Governmental Program Analyst with the FFPSA unit, along with Felicia at DHCS. We are excited to be part of the 2025 convening with you. Building public-private partnerships is important for supporting foster youth or potential foster youth in California, because these partnerships help address the unique challenges they face. Partnerships can improve outcomes by aligning services, data, and initiatives. They can help us build a stronger support system and help us to identify best practices through sharing information and insights, which results in improved outcomes. Our team seizes opportunities to engage in learning experiences that amplify the voices of youth and caregivers with lived expertise. We do not take for granted the importance of centering those most impacted as we carry out our day-to-day work. We are delighted to continue this effort alongside all of you today. We hope day 2 of this convening helps us all continue to learn more, support one another, and to use that information and support to provide better preventative services and resources to the youth we all serve.
And again, we want to thank you all for coming. We do understand and appreciate your time because we know it's valuable. We appreciate you for being here today. And Ms. Sarah LaCroix, we hand it back to you. Thank you so much for the opportunity for letting us welcome everyone.
Thank you, Sarah and Felicia. So happy that you all wanted to welcome, and it's been great working with you these last 6 months in planning and prior years too. Thank you. So I now have the distinct pleasure of introducing our keynote presenter and also our partner joining. So I'll first do an introduction for the wonderful Alyssa Burke, who is a former foster child and youth and an individual and parent with lived expertise. She's been a certified HOPE trainer and HOPE champion in California since 2022. Since 2028, she's provided direct intervention and advocate services to children, youth, and families enduring crisis. 5 years ago, she transitioned to prevention services and has been the child abuse prevention coordinator for her local community since 2020. She believes that if pain and trauma can be passed down through generations, so too can healing and hope. She's a passionate and electric encourager of spreading hope and leaving a heartprint wherever she goes. She has a deep passion for child abuse and neglect prevention and fully believes that prevention is possible. Alyssa, welcome. I will now introduce Dr. Bob Sege, who is a professor of medicine and pediatrics at Tufts University School of Medicine, the director of the HOPE National Resource Center, located within the Center for Community Engaged Medicine at Tufts, and is the co-director of the Community and Stakeholder Engagement Program at the Tufts Clinical and Translation Science Institute. He's a fellow at the Center for the Study of Social Policy and has been a board-certified general and child abuse pediatrician for over 20 years. Dr. Sege is known nationally for his research on effective health systems and approaches that directly address the social determinants of health. His academic work incorporates community engagement at all stages of design, implementation, dissemination, and improvement. At the HOPE National Resource Center, he's led numerous publications that include research on the prevalence of positive childhood experiences, or PCEs, among adults, corporal punishment, and child physical abuse during the COVID-19 pandemic, to name a few. In recognition of his work identifying the importance of positive childhood experiences, Dr. Sege received the 2022 Richmond D. Krugman Award, presented by the National Foundation to End Child Abuse and Neglect, NCAN, and the 2019 Ray E. Heffer Award from the Alliance of Children's Trusts and the American Academy of Pediatrics. Dr. Sege holds a medical degree from Harvard Medical School, a PhD degree in biology from Massachusetts Institute of Technology, and a bachelor's degree in biology from Yale University. He's an avid swimmer and lives in the Boston area, where he and his wife have raised their 3 now adult children. Welcome, Dr. Sege. So nice to have you.
So it's just so nice to be here. And Sarah, thanks for all the work you and your team have done to make this collaboration possible. So if we can go to the next slide. Today, we're going to talk about building on our progress, advancing community well-being through authentic collaboration. And in particular, I'm going to introduce or reintroduce everyone to the HOPE, Healthy Outcomes from Positive Experiences framework, which we've had the pleasure of working with so many of you in California on so far. And the next slide. Just want to introduce you to our team. I get the pleasure of being here today. We have a terrific national team led by Dina Burstein, Amanda Wynn, and Amy Myrick. And you can see the rest of our team here. They're located in Massachusetts, Rhode Island, Maryland, and Oregon. So let's go to the next slide and just jump right in. Just to give you a sense of how we're going to be talking about this, I'll give a brief introduction to what is HOPE, Healthy Outcomes from Positive Experiences. Then we'll move into how we develop the Positive Childhood Experience Scale. And then we'll take that and relate it to everything you already know about Adverse Childhood Experiences, or ACEs. And then we're going to talk about neuroplasticity and the developing brain. And I know Alyssa in particular is a big fan of brain healing, and we all are. And then we'll talk about the HOPE framework. And finally, the bulk of today will be spent on HOPE and California. So let's move along to the next slide. Fundamentally, just to start, HOPE Informed Care recognizes, honors, and promotes positive experiences because they're fundamental to people's health and well-being. And we're going to talk about that in some detail, but think about it. How much of our care, whether it's healthcare or social work or child abuse prevention or anything else, starts out focusing on the things we're ashamed of and the bad things that have happened to us, not on the positive experiences that we bring to the page. So to make this more personal, on the next slide, I want to invite everyone to hold in your heart someone you know who had a difficult childhood and is now a thriving adult. This person could be yourself, it could be a friend or a family member, or it could be a public figure. We're not going to ask you who this person is. It's just from time to time, we'll say, reflect on that person and how it was that they had a difficult childhood and now they're doing okay. Next slide. So what we know from research, reviewing a little bit of it, is the positive experiences promote children's health and well-being by allowing children to form strong relationships and connections to create a positive self-image, self-worth, and a sense of belonging. And these attitudes and skills promote resilience because let's face it, we never know when adversity is going to come. And there's probably no one in the world who hasn't had some hurdles to climb as they grow up. So the trick is developing skills that allow us to be resilient. Next slide. Our standard systems focus on the negative and the screening tools, and we can talk about this more if you want, but some of the screening tools really codify implicit bias. Some of the questions they ask are experiences that are more common in marginalized people. But in any event, they create a presumption of deficit. So in the next slide, what happens if you flip that around and we shift the narrative and identify people by their strengths as well as their challenges? And instead of assuming there are deficits and problems and bad stuff, we assume their strength and we develop a sense of curiosity about where that strength comes from. On the next slide, what we're doing now is just to talk to you a little bit about the science so we can dive as deep as you want. But I want to make sure that people leave today understanding that this is not just good wishes. There's actually a ton of science and publications that goes to how the HOPE framework works and how it fits with what we've already know about trauma-informed care. So the next slide has the questions that we've added to the behavioral risk factor surveillance system, first in Wisconsin and now in more than half a dozen states around the country. So we added these questions to a standard survey conducted by each state, informed by the CDC, and we asked people, thinking back to when you were a child, up to the age of 18, how often did you feel able to talk to your family about feelings? How often did you feel your family stood by you during difficult times? How often did you enjoy participating in community traditions, feel a sense of belonging in high school, feel supported by friends, have at least 2 non-parent adults who took a genuine interest in you? And how often did you feel safe and protected by an adult in your home? And if individuals said that they had this often or almost always, they got a point, and you can have a 0 to 7 positive childhood experience scale. Now, the next slide shows the results, which were kind of amazing, that just from these 7 questions, we found that people who had those positive childhood experiences, 7 out of 8, 87% had good mental health. However, if they only had 0, 1, or 2 positive childhood experiences, that number plummeted to only half who had good mental health. And of course, those with the middle number were half as likely. So you can see there's a big difference just by these experiences. And this was done in Wisconsin. And the next slide shows that we've now, working with our colleagues at the Center for Disease Control, led by Elizabeth Sweeto and Phyllis Nylon, we've started to look at more states. And we can see this was published in 2024. And the next slide shows some of those results. What we found was that individuals who had 6 or 7 PCEs compared to those with fewer, 3 to 5 or 1 to 2, were more likely to have attended or graduated from college, more likely to have an income of family income of $50,000 or more likely to have one of those two things. So we know that not only do positive childhood experiences have significant health outcomes, but they also have opportunity outcomes as far as education and adult income. On the next slide, we looked at some of the health outcomes, and this was done in California, looking at the California Behavior Risk Factor Surveillance System. And what they found was that adults in California who reported more positive childhood experiences when they were growing up had less cigarette smoking, less alcohol consumption, lower rates of depression, which, remember, is the most common mental health problem in Californians. And they had overall better health. So nationally and in California, these results are pretty impressive. We next looked and saw what was in the literature, and we did a review of 220 published research papers. And what we found was that in all these papers, positive relationships had a beneficial association with reducing suicide. Positive environments had a beneficial association with substance use, the substance use disorder, and engagement had a beneficial association with all outcomes. So when children and youth are engaged with their families and communities, they do better. Next slide. But what about ACEs? So I know in California, thanks in part to the work of Nadine Burke-Harris, there's a lot of knowledge about ACEs. There's ACEs Aware, and in healthcare settings, many people are being screened for ACEs. The next slide just has a reminder of what the 10 ACEs are: 3 kinds of abuse, 2 kinds of neglect, and 5 kinds of household dysfunction. And you can have a score, of course, from 0 to 10, with 4 or more ACEs being considered as a troubled childhood. The next slide shows a quote from one of my favorite people, Carl Bell, who's a Chicago child psychiatrist, who in 2009, as part of the National Academy of Medicine report, said, "Risk factors are not predictive factors because of protective factors." So as we know, and if you think now about the person who you're holding in your heart, who had a troubled childhood and is now thriving, think of them and we'll think about the protective factors that may have helped them survive these childhood difficulties. On our research shown on the next slide, if you look just at people who had 4 or more ACEs in the same survey from Wisconsin I showed you earlier, if they had 0, 1, or 2 positive childhood experiences, most of them reported depression or poor mental health. If they had 6 or 7 positive childhood experiences, on the other hand, most of them, 4 out of 5, did not have depression or mental health problems. So in other words, a positive childhood experience will protect us even in the face of a high ACEs score. Next slide. So I wanted to say, because we've all gone through, or many of us have gone through, the trauma-informed care revolution. And the first bullet point in this slide is that we know that children's brains respond to experience. That's what we know about toxic stress and all the wonderful work done with the Harvard Center for the Developing Child looking at children's brains. We also know, the next bullet point, that children from birth to 3 and adolescence are sensitive stages. And I always want to quote Nadine Burke-Harris, because I heard her say once, "Oh yeah, another study that showed water is wet." So anyone who's ever known an infant or an adolescent or been an infant or adolescent know about the explosive growth during these time periods. And it's no surprise that that growth is sensitive to the environment that children live in. Next, the next point is that it's important to know about these, and that's what trauma-informed care and ACEs screening is all about. If we know about those childhood experiences, we can help people. But think about all of the experiences that kids might have had, whether they're adverse or positive during these sensitive periods, and knowing about all of them can be helpful. Next slide, the next point. Most adults understand that childhood experience matters, and I think that that's been a real contribution. that you don't have to start off where they used to, oh, children are resilient, nothing matters, or they'll grow out of it, or all those things. Childhood is important. And finally, and most importantly, we know from our own personal lived experience, from people we know, and from the person who you're holding in your heart who had a tough childhood, that people can heal even after past trauma. So as Carl Bell said, risk factors like ACEs are not predictive factors because of those protective factors. So on the next slide, now we're going to go and talk a little bit how it works. And just a really brief dive into neuroscience. No worries, not very deep. Next slide. How do children's experiences affect the brain? Next slide. Through neuroplasticity. And that's a really big word, but it just basically means that the brain can rewire after trauma. Each of us has between 1 and 4 billion brain cells. Each of those brain cells has up to 10,000 connections. So if you want to see how many paths there are in the brain, you just take, say, 1 billion, multiply it times 10,000, and then that new nerve cell also has 10,000 connections. So they multiply that times 10,000 and then times 10,000. And if you do the math in your head, you get to a really big number. There are lots of paths through the brain. And the next slide shows how this works. Every experience we have that calls on multiple brain cells causes connections to grow. When brain cells fire together, in other words, they're activated, they wire together. And so if you think about it, one of the things we know, for example, and this has been visualized using magnetic resonance imaging, it's MRIs, when an adult learns how to read, they develop connections between the visual cortex that processes our vision and the part in the front of our brain that processes language. And you can look at a person's brain through an MRI and see these strong connections have been formed. And what you see in the MRI is actually insulated highway kind of connections that move signals back and forth really quickly. That's how experience works. And we are created to have that ability to rewire based on experiences. Next slide. So how does this relate to hope? So I told you about positive childhood experiences and their effects, talked about adverse childhood experiences and their effects, how the brain rewires. But what we want to do is take that science stuff from up here and make it something we can actually use in our work. And that's how we came up with the HOPE framework. And the HOPE framework on the next slide talks about the 4 building blocks of hope: relationships, environment, engagement, and emotional growth. Let's dive in, looking first at relationships. Stable, nurturing relationships with children and adults through interpersonal activities promote optimal child growth. And these all start, of course, with family relationships, right? We're all born, we look around, there's the person who gave birth to us. And then immediately we have the people who raise us. Babies are a little helpless. And those adults, and then by the time children get to be even as young as 2 or 3, they begin to form peer relationships, which by the time they're teenagers become all important. But in addition to those childhood friendships, we also know from our surveys and from work and from our own experience that having an adult or 2 adults, other than the parents, who cares about the child makes a big difference. So whenever I present this slide, I always think about a particular high school teacher who really got me when I was, when I needed to have someone understand what made me tick. And that's how my career got started, because Mr. Phillip sort of saw something in me. How many of you, don't have to raise your hands, just think about it, can think of one adult who really understood you and helped you get going? The next building block is environment. And that's sort of on 2 levels. First of all, we need safe, equitable, stable environments for living, playing, and learning at home, in school, in our neighborhoods. And physically, very basic. We need a roof over our heads, food in our bellies, healthcare, all of those things. But psychologically, there's a ton of research done on school environments, safe neighborhoods, and really a home that's free of fear. If you think about it, childhood is a little scary because you don't know anything yet. And having an environment where it's safe to run around and do those normal crazy things that kids do is so important. The next thing, and we talked about earlier, is engagement. Social and civic engagement is how we develop a sense of belonging and connectedness. And so whether you sing in the choir at church, or you help your mom with your baby brother, or you participate in an arts program after school or on the football team, if you're in a group and you're engaged and you know you matter, it makes a huge difference in our development. So we want to make sure that every child has a place where they belong and contribute. Next slide. The other thing is emotional building blocks, and emotional growth happens through playing, interacting with peers for self-awareness and self-regulation. And honestly, watching child-directed play, particularly when kids are young, you're seeing emotional growth, but it's pretty ugly. Kids will bicker over the rules. They'll talk about that's not fair, this and that. What they're really learning is to understand how to communicate their emotions, how to win, how to lose, and most importantly, the other person also has a viewpoint. We know that access to nature in particular is important. And for older kids and teenagers, being a mentor or a peer leader is enormously helpful because they have to deal with their own emotion and their own emotional life to help other people. Next slide. But I want to just make clear, although we talked about ACEs and adversity and you're holding in your heart someone, a difficult child, positive childhood experiences are needed for every child. They're like food. They're not just the medicine for adversity. These are the core things that every child needs to develop optimally. The next slide, as we all know, there's a lot of inequity in the United States. Different people, by virtue of their origins or their looks or whatever, have different experiences. So if you just look at the dots on this graph, you'll see that in this study that we did in the 4 states, white Americans were more likely to have a score of 6 or 7 on PCEs. But for those of you who aren't familiar, these bars show the variation within each subpopulation. So 90% of people in that group fit somewhere in those bars. So look at how big the bars are for most of the populations. Like for Asian Americans, it goes from 35 to 60% with 6 or 7 PCEs. So what that means is, although the problems of bias and discrimination and unfair systems are enormous, you don't know about a person until you know about a person, because the variation within each of us, within our groups, is also very high. And that's why we've created Hope the way we have, because we want to make sure that each person's culture, the resources that are available to them, and their beliefs go in to determine which relationships, environment, engagement, and emotional growth matters to them for their children or for themselves if they are children at that time and place. And that's a core value of what we do. So the way we do Hope implementation is we work with organizations to go through 6 steps. First, thinking about creating hopeful screening forms and processes so that when people arrive, when we first meet them in the care we provide, we don't just ask about everything they're embarrassed or ashamed of. We also ask about their strengths and things they're proud of. We do referrals, but in Hope-informed referrals, those referrals might be, did you know that there's a choir at the church you're a member of? Or did you know that there's a cultural festival coming up? Or there's a program for what kids who have artistic talent like you do might get hired to do graphic arts. So not just professional referrals, but really figuring out people's strengths and how to work on them. And doing all this means modifying our forms and practices so that strength-based stuff is not an add-on, it's a core. It's at the very beginning of the interactions. And the next slide has the other 6 elements that happen. We look at our policies. review and revise policies using the building blocks. So for schools, if you think about children who misbehave, who get suspended or expelled, it solves a problem for the school, but for the child, it deprives them of relationships, of a safe environment, of opportunities for engagement. So maybe there are other ways to deal with a child's misbehavior. Hope for equity advancement. We ask organizations that use Hope to really look at who uses their services, who uses what services, how they do or don't represent the community that they're trying to serve, and dig in to see how we can assure equitable access. And finally, an internal culture of hope simply means changing our mindset so we see the positive in each other as well as the problems. So how does this all work? So the hope theory of change is actually really simple. We think that adults help create supportive environments. And these supportive environments in turn make it possible for positive relationships to develop. And those positive relationships can then feed the positive childhood experiences that we just talked about. Positive environments, positive relationships feed these experiences. And these experiences make it possible to become engaged with your family and community. So if each of us thinks about how we got engaged, sometimes I saw a poster somewhere, but sometimes it's a friend or a person, someone I have a relationship who says, Bob, you know, you really might like this, or come with me. So all these things, we have these building blocks all separate because we're science people, but they're actually all linked together. And what we know from this is that you then have social, emotional, cognitive growth, healthy outcomes from positive experiences, and all of these things reinforce each other. So they play together. So the positive feedback, or what some people call virtuous cycle, as opposed to other kinds of cycles. Next slide. We're undergoing a transformation now in California and elsewhere. And we're going to talk about that a little bit. In just a moment, I'm going to ask Alyssa to talk with us for a bit. Next slide. So when I say transformation, it's amazing what's happened. We started this project. We got our first real grant in 2020. We started this project when the pandemic started, 2020 and 21. We set up networks and certification. Now we have nearly 60,000 providers have been reached by staff and 500 certified facilitators around the country. Next slide. And in particular, in California, there are 85 facilitators. We've done 43 workshops around the state since 2021, and we have 16 Hope champions. And at this point, I want to stop and turn off the slides and reintroduce Alyssa Burke. Hi, Alyssa.
Hi, Dr. Sege.
So you heard before that she's a Hope champion. She's been involved in providing direct intervention and services for children. She's a child abuse prevention coordinator in her community, and she has her own lived experience in this system. So Alyssa, welcome. And I'm really glad I got a chance to meet you. We've had a few occasions to talk over the past few weeks, just getting ready for today. And if it's okay with you, can we just dive in? I can ask you a few questions.
Absolutely. Thank you.
So, first of all, big picture, how is Hope showing up in your own work?
How's Hope showing up where? Sorry, I didn't hear that.
In your own work, in your work as a Hope champion, and the work you're doing in the comprehensive prevention plan and everything else.
Yeah, great question. So for me specifically and personally, I don't provide that direct service as much anymore. I'm more on the prevention side of things. But as far as providing various different Hope trainings to child, youth, and family service providers in our community, including public health, early child educators, parents with lived expertise, kind of the large perspective of Hope is just bringing the awareness to our community, bringing the awareness of Hope, educating individuals in the community on what Hope is, along with pieces. A lot of individuals that I've talked to in the community are very aware of ACEs, as you mentioned previously, but hadn't necessarily heard of the positive childhood experiences. So in me becoming a hope facilitator and champion in my community and county, it has opened up the door to educate and collaborate with various different service providers and parents on the education of the pieces, along with the 4 building blocks and how we as individuals can incorporate those into our own personal lives and our professional lives, along with kind of having a self-awareness on if there's any implicit bias that we might be aware of or unaware of, that might need to be able to be removed in the work that we do on a daily basis and in our own personal lives.
So that's terrific. And it sounds like it's been really important for you. And when you said implicit bias, it just reminded me of my own professional career. I worked at a safety net hospital where we had people who had substance use disorder who were pregnant, who were cared for in a clinic called the Respect Clinic that took care of their substance use disorder as well as their as well as their OB needs. And then some of the kids came to me with their moms. And as a doctor, I'm trained for deficits, and I know that substance use disorder is bad. I know that people who have that often have a variety of other mental health problems, difficult childhoods, domestic violence, all kinds of stuff. So in my head are all those risks that I learned about. But what I was able to do when we started thinking about hope was understand that this mother who was bringing her baby to me was an amazing person. That from talking with them, many times the people who knew them and loved them said, because of your substance use disorder or whatever, you're not fit, you shouldn't bring the baby to term. And obviously, they were with me, with their baby, they hadn't chosen that. I also knew that they had entered into and stayed in recovery throughout their pregnancy. And talking with people who've had substance use disorder, that is difficult. So they had done that. And then our state, Massachusetts, is a mandated reporting state, so that every single one of them, when their baby was born, they had a conversation with our child welfare system. And the result of that conversation was they had custody of their kid. So now I saw a person had a problem, like you can't gloss it over. Substance use is a problem, but it was an amazing person who had done all of those things. And I had that curiosity. And when you said implicit bias, because my bias going in was, oh no, another blah, 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 who has this problem. But then by talking to people and learning and reflecting on it, I was able to change my own outlook. And we had a research assistant. I got to watch her go through this whole process because she had, very strong values about drug use. And then as she got to know the individuals we worked with, all of a sudden they weren't just a problem; they were a person with all these things going on. So I'm sorry to tell my own story, but I just wanted to put that in because you mentioned the work that it requires to overcome our own implicit bias. Not even necessarily sure that you have it until it comes and slaps you in the face and tells you this is going on.
Yeah.
And do you want to talk a little bit about how hope affects your work with the parent and guardian advisory council?
Yeah, absolutely. So personally, our team for the Parent Guardian Advisory Council, we're not operating out of, implementing hope into the work. But for myself personally, as a hope facilitator and a champion, I have chosen personally to kind of incorporate and implement the hope framework and the pieces framework in regards to the Parent Guardian Advisory Council work that we're doing. So in our community, it's myself and then my wonderful colleague, Beatrice Schaefer out of the Tahoe Truckee region. Her and I are facilitating monthly Parent Guardian Advisory Council meetings with local parents and guardians in our community. And the design and shape of these meetings was to have a safe place, a safe, non-judgmental place where parents could come and share their lived experience because they're the experts and what it's like to be a recipient of concrete and supportive services throughout our community. And so what we're doing is the group itself, the parents each get a letter. So that way it's anonymous and their privacy is respected. And so in that process, the parents come to these meetings, and at the very beginning, we ask them to create this list and just openly share about all services that they're receiving, additional services that maybe they would like to see in our community that might not be existent at this time. And so with these parents, they're showing up at these meetings, and it was a challenge at first for the western side of our community for parent engagement, but I just kept thinking of hope. Like, how can I continuously persevere to get these parents to the table, because their voice matters and their lived expertise matters. And so not giving up, just continuously persevering and pursuing these parents. And so at these meetings, we ask a series of questions in regards to the concrete and supportive services in our community, and they're parent led. And so with the questions that we're asking, they come from the hope framework lens. So we ask them, like, what is working well? What is working well with maybe your CalWorks services or your Medi-Cal services or public health home visiting services, whatever that might look like. So it's asking them what is working well, and then asking them, secondly, like, what areas do you feel like there could be an opportunity for improvement? And though it's, not necessarily the pieces aspect, I look at it, when we choose to ask parents what's working well, we're choosing to ask them to engage in that paradigm shift, like we would pieces of asking somebody those 7 pieces. Like, did you have, a trust in an adult in your home that you could trust growing up, things like that. And so it's been really interesting to see the dynamics in this incredible group with these parents, that when they are able to focus on what's going well in our community and then analyze and share areas that might need improvement, it really does shift their mindset, and they have a deeper appreciation of our community, and they also have a deeper hope. Our community, some parents come to these meetings feeling pretty hopeless, or feeling like our county is not meeting their needs. And so I've experienced in these parent guardian advisory council meetings, focusing on kind of that hope framework of it, that they feel more hopeful and positive for our community as a whole, and for their own individual selves and family.
Listen, that's great. You actually piqued my curiosity. Can you think of sort of an example of something that someone said that's going well in the community that was you think would be worth sharing?
Sure. So I will share something that's going well. Is we have parents that have found themselves, a couple of them actually, in really challenging times and situations that kind of came up unexpectedly. And so some of them maybe went from working full time to not working at all. And so they had to learn to navigate the systems in our community. So maybe they needed to get onto Medi-Cal or CalFresh or various things because they have children in the home they need to provide. They also might have had some stressors as how they were going to pay their rent and or mortgage, things like that. So we've had parents come to the meetings and share that they were able to work with somebody at the county level in one of the departments to get them connected to these services, as soon as possible, so their child and themselves weren't going without food. They weren't going to be hungry, things like that. So some of the parents have shared what's working well is they've had a great connection with their county worker in regards to the service delivery and becoming engaged in the services altogether.
That's great. And I'm really glad you highlighted that, because I think that there's a lot of rhetoric about how government employees don't care. But I think that the experience of how many of us in the room and other people who work and are funded to work with families actually really do care and have that feeling of empathy and understanding that makes it work. And I love that when I asked you that open-ended question, the story you came out with ended up with a county worker who got it and was helpful. That's, to me, in these times, that's great to hear.
Yeah, and if I could just add quickly too, something that was really great is we had a local county worker come to our meeting back in January to hear from our local parents and guardians, and then also for the parent, a learning session. So the parents can learn from the governmental county worker, and then the county worker can learn from them as well. And a lot of the parents, their takeaway was like, wow, I had no idea maybe the caseload at the county was, at this high level or things like that. So it allowed the parents to also then have a lot of grace and patience and understanding towards our county personnel as well.
So that's great. From the research side, we asked thousands of parents across the country during and after the pandemic what helped, as well as what caused problems, because it was tough. It was tough to be a parent, kids from school and all those things. And I think a lot of the government programs like the tax credit, the unemployment insurance, all kinds of things really help families survive. So it's important to remember that nobody can do it all on their own. And that all of these supports really matter. I want to flip a little bit and ask you, when you make a comprehensive prevention plan, does the HOPE framework play a role in how that works? And I'm speaking as a non-Californian, so I don't know what a comprehensive prevention plan exactly is. But is this something you can help me understand, and how HOPE helps with that?
Yeah, so again, specifically, our county is not necessarily implementing HOPE into our comprehensive prevention plan or our CPP, but it's something that I've definitely brought to the attention of the comprehensive prevention planning team, because I can just stand from mountaintops and just shout about HOPE and pieces all day long, joyfully. And so it's just basically bringing that introduction, but how we have implemented the HOPE slightly into our comprehensive prevention plan work is we did host a HOPE training for our local parents and guardians who are a part of that Parent Guardian Advisory Council meeting. And we were able to provide this training for them, which the feedback from the parents was pretty incredible for them personally and for their family. So they were just really grateful to be able to have learned this information and then take what they learned from the HOPE training and then begin to implement it into their own personal lives.
Alyssa, can you just comment? I don't want you to share more than you feel comfortable with. But can you talk a little bit about how understanding the HOPE framework helps people who have had lived experience understand their whole experience, not just the traumatic parts, and maybe understand themselves a little better?
Yeah,
I should
absolutely.
say
So I
themselves.
think with the parents, from what I've gathered and then my own personal experience, is that, right when there's trauma, right, we know that trauma can negatively impact the mind. And so it can put people in kind of a deficit mindset as far as thinking negatively, or that's kind of their first reaction in response. Or if a crisis strikes, that's kind of their first reaction, is what's not working well versus what's working well. So when I've provided this HOPE training to parents and guardians in our local community, what really struck them was the 4 building blocks and then the pieces. So it allowed themselves to take inventory of their own personal life or their own childhood, kind of like you had mentioned for us earlier, to hold somebody in our heart, but kind of do a tough inventory of themselves and their childhood and their current situation, and really ask themselves like, oh, did I have one of these 7 pieces? And when they can acknowledge and recognize that, it's kind of like an aha moment where they're just like, oh, okay, wait, yeah, I did have this teacher. And then it kind of is like a building block from there. And it kind of is like this wonderful effect of like, oh yeah, okay, so I had one sports coach. Oh, I had another teacher. Oh, my friend's mom. And it just is really amazing to just see how the mindset just literally begins to shift from a deficit or a negative mindset to the positive. And then when they're looking at the building blocks and other things, it really allows them to take inventory of, I may have not had the greatest childhood or relationship with my parents, but I desire that with me and my own children. So what can I do as a parent to improve relationships, maybe within the home, obviously, for my kiddo, and then socially with my coworkers, with people in sports teams or church community, faith-based community, things like that. So it's really allowed the parents, I mean, they've come back to me time and time again and shared with me like the excitement, like, oh, this relationship in my life has improved since the HOPE training, or my relationship with so-and-so, their worker or whatever has improved, or they've gotten their kiddo more connected to the environment of our community, things like that. So really just allowing the parents to be educated and aware on those 4 building blocks, and then how they can improve and have healing within those 4 building blocks, which creates more of a positive kind of perspective for them for the future.
Great. Thanks so much. And that is, I think, for me, one of the joys of doing the kind of work I do, where I get to meet people around the country and around the world and talk about hope, is how many people reflect on themselves and how it helps healing, just by understanding that we are not the sum of all of our problems. We're actually,
Absolutely.
we got these things, we got those things, we're complicated. So
Absolutely.
I just want to encourage people to put questions in the Q&A section. In just a minute, I'm going to ask Sarah to read some of those questions so Alyssa and I can respond to them. So I can't really see them well from where my screen is, but Sarah has volunteered to read some to us. So Sarah, do you want to get started now with a couple of questions?
Absolutely. So one of the first questions.
Oops, can't hear you.
Oh, can you hear me now? Is that better?
Yes.
Okay, awesome. One of the questions is from Megan Gotcher, who asks, are there evidence-based practices associated with positive childhood experiences and hope?
That is a great question. So we did this scoping review. There are 220 research articles that show the effects of different kinds of experiences on children. We don't yet have an evidence base for hope-informed practice for 2 reasons. One is it's brand new. So we don't really have enough experience to have done the kind of trial that we would make an evidence-based practice. But the other one is deeper, that we don't have a manual that people fill out, do everything they're told to do. We ask people to combine the science I told you about, their values, their culture, and their resources, and then use it. So we've just hired a new evaluator, and we're trying to figure out how best to look deeply into it. But the stories we've heard have been absolutely transformative. Certainly, it helps the staff. And I think, as Alyssa has said with their Parent Advisory Council, it's not rocket science to see what effect it has. And we know in the medical setting that it increases engagements. People are less likely to not show up for their appointments. Their kids get their shots on time, all of those things. So all these indirect measures. It's a really good question, and something that we're working on and expect more next year.
Nice, thank you. We have, let's see, there was one, how does, from Rocio Abundis, how does this HOPE framework take into account the 40 developmental assets?
Sure. So for those of you who don't know, the Search Institute has 40 developmental assets, and they have a survey that's done mostly at a community level. It's proprietary, so you have to pay to use it, but it's terrific. And a lot of communities have used that. And I think that it's one of a number of things that are kind of lined up, right? Because the developmental assets and the Search Institute, the building blocks of hope, the strengthening families model with the 5 characteristics of strong families, Wendy Ellis's work on building resilient communities. This all goes together. So what we're seeing, and the Search Institute was pretty early along here, is this transformation from only looking at the problems to also looking at the positives. So they line up really well. And what we've seen published is people take their models, like the Search Institutes, but obviously everyone has their own, and then uses the building blocks of hope to categorize which ones of these make positive relationships more likely, which ones make safe environments for children to live, learn, play, explore. Which ones help with engagement, make opportunities for kids to be engaged in after-school sports and art and the spiritual life with their family, whatever. And so you can then categorize things like the 40 things in the Search Institute's criteria that actually fall in those categories. And we're starting to see more and more publications that take these more complicated models and use this as a classification system.
Interesting. Thank you. We have a question. This was from an anonymous person. Much of public health work, such as in maternal, child, and adolescent health home visiting programs, have been developed with a trauma-informed approach that was based on ACEs. How would this work change if we adopt the HOPE approach?
Great question. And I think I'm going to say something, and Alyssa can certainly say something as well, because I think you've been through it at every stage. So what I think is that what we learned from ACEs is that childhood adversity can have really bad effects on kids. And it does that because their brains are growing rapidly because they're sensitive to experiences. But it's only the other half, or what are the positive experiences? So what trauma-informed care helps you understand is why a person's behavior is the way it is. It doesn't necessarily get you to, well, exactly what can you do to help them heal beyond if they have a diagnosis and psychiatric treatment. So when we finish the question and answer, I'm going to introduce you to something called triads from UCSF that really integrates HOPE and ACEs. And hopefully that will be helpful. But it's a really important question because so many of us have been deeply steeped in ACEs and trauma-informed care, which in my view sets the background to understand HOPE. Alyssa, do you have something to add to that?
Yeah, and I hope this answers the question, but I'll just share some feedback that I've received from parents in the local community in regards to that. Is what they have felt as at times, let's say they go to an appointment and they have to do an intake. On that intake form, they've shared that majority of the questions that are asked are more, they feel deficit based. So they feel like at times they're leaving for an intake, no specific department or organization, but leaving there feeling like, wow, I just talked about all the things, all the trauma that's happened in my life, right? And I have this ACEs score of 4 or 6 or whatever that is. And that feels like a high number. And then some of them have even gone as far as like Googled, what does it mean when I have an ACEs score of 7 or 8? And kind of the information that comes up. So parents' feedback to me has been, sometimes I go to these intake appointments and I answer the questions because I need to, because I want to engage in these services that are going to support my family and meet our needs. However, I really feel doom and gloom now. I really feel like, oh my gosh, am I my ACEs score? Is my life going to improve? Are me and my children going to have these detriments to our health and so on and so forth? And so when they've learned about the HOPE, again, focusing on those 7 positive childhood experience questions and things like that, they have shared that it's allowed their own minds to shift and feeling like, okay, I may have an ACEs score of 8, but with these pieces, if I can focus on these pieces and if I can believe that hope and healing is possible within my own life and my family, no matter how long generational traumas have been running in my family, like it can stop and improve with me. It can stop and improve with me and my children. And it just inspires them to be more hopeful rather than feeling like they have this daunting ACEs score that they feel like is kind of like their identity that's never going to get better. So when they've learned about the HOPE framework, it's allowed them to feel like hope and healing is possible and that their identity and their destiny is not in their ACEs score. I hope that answers your question.
Alyssa, thank you. Thank you so much. That was a wonderful thing. We're going to have to move along. So if there's time at the end, we'll answer some more questions. But Alyssa, before I go back in, I want to spend a little more time talking about HOPE implementation. Before I do you have any last words? Hopefully, that sounds horrible. Sorry. Is there anything else you'd like to say before I go back into the PowerPoint?
I would. So I would just like to give a big, huge shout out to Barbara DeGraff with Strategies Technical Assistance. She has been an integral person in our Parent Guardian Advisory Council meetings, and she has been our note taker, and she has been there to see the work that is being done and being a part of that. And I just think, again, that kind of incorporates hope because it's relationships, right? Barb is with Strategies and I'm with the Child Abuse Prevention Council. So it's grown that relationship. And to just see Barb be just as passionate as, you know, she doesn't live in our county, but she's passionate to hear and learn from these parents. And, you know, hopefully, you know, together we take that information and take it back to our county to advocate for positive change and improvements within our community. So just Barb and Beatrice absolutely have been just so amazing to work with. And it's just been great to see the way that ourselves and our planning team are showing up for these parents and believing in it. And actually, I don't know how to say this, but really valuing the lived expertise, because I feel like some people say like, oh, we want to hear from those with the lived experience. But then when it comes to hearing it, they might have to hear hard things about like an organization or a department or something, and it might not sit well with them. But to just be able to sit in a place of uncomfortability and really hear from these parents and take what they share as valuable information and advocate for that change, I think has just been very revolutionary for my community as a whole. So thank you.
Thanks, Alyssa, and thanks, Barbara. So if we can go back to the PowerPoint, I want to talk a little bit more about how to implement hope where you are, because I think that hopefully Alyssa and I have together piqued your interest in hope. We have individual learning and certification, and we have hope resources and learning hub that's available from our website, mostly for free. If you want CME or CEU credits, there's a fee for those. We have to pay a fee. And then people can become a certified facilitator or a champion like Alyssa. Facilitators learn to conduct introductory training. So the kind of training that Alyssa told us she did for her advisory council members, all kinds of things. And champions go a little bit deeper, and they learn how to facilitate organizational change. And finally, organizations can become hope informed, and we have a process that helps organizations do that. And it's really transformative. It changes how we interact with patients, clients, participants, whoever it is who we work with, and also transform our staff. And we did this at the primary care center here at Tufts, and it's a wonderful thing to see. There were great doctors, great staff before, but now the clinic has a very different feeling to it, and our patients feel more welcome and understood. So we encourage you to do that. It's all on our website, positiveexperience.org. Next slide. Here are some of the free resources that are available. If you go to our website, there's a tab called Resources. We have resources in English and Spanish. We're rapidly growing in our Spanish language things. If you need another language, shoot us an email. We have philanthropic funding to translate it into anything that you need. On the next slide, just how you can get involved. We have a virtual learning hub, and the learning hub has courses. Most of them are 1-hour courses. There are now 6 of them. The slide is out of date because the coming soon is already here. We have Introduction to Hope, Hope for Substance Use Prevention, Home Visitors, Child Welfare, and Hope in Strengthening Families for children involved in the juvenile justice or child welfare systems. More titles coming soon. These are available online. You get CME or CEU credit if you like. They each take about an hour, and they're becoming lots of people, hundreds of people have taken them, maybe more, a lot. But hopefully it's interesting. We have the Intro to Hope also available in Spanish. Next slide. So let's talk about hope in California. Next slide. So I know that the part of this conversation has been about the integrated core practice models. So we spent some time with Sarah and with others talking about ICPM. And the next slide shows a little bit of how these line up, because what we want to do is make sure that the Hope framework is wind behind your sails, helps you with the work you're doing. It's not one more thing to do. So what the California Integrated Core Practice Model tries to do is involve kids with caring relationships, strong families, parents, and caregivers, services that are fair for all cultures, and ensure that kids get help they need quickly and easily. And the next slide shows a little bit about how some of this interacts with hope. So these are the 4 building blocks, the relationships. ICPM is parent and youth driven, which really centers on those relationships between those of us who are service providers in one way and the people who we work with. It's designed to be community-based and least restrictive and equitable. And that all touches on having safe and equitable environments to live, learn, and play for the children and their families. Engagement. Attention to culture and language is at the core of HOPE. It's at the core of ICPM. No conflict there at all lines. And I think one of the nice things about ICPM, and you see in the chat, I think you have a handout about it, is that all of us look for experiences that drive resilience, not focusing on punishment and isolation, but focusing on creating resilience. And if you think back to your professional experience or to the person you're holding in your heart, think about what a difference it makes if when bad stuff happens, you learn to be resilient rather than become punished and isolated. Next slide. So in answer to one of the questions, I talked about the triads model from the University of California in San Francisco. And Alicia Lieberman and her team have been very involved in ACEs Aware in California. They're also the ones who developed parent-child psychotherapy. And they developed a model called Trauma and Resilience-Informed Inquiry into Adversity, Distress, and Strengths. And the model is very straightforward. It says that our experiences sort of fit in this triangle, right? So distress is why people come for service, what they're interested in. Adversity is what happened to them, the standard trauma-informed question. And strengths, hope, those are the things that prevent adversity from leading to distress and help distressed people recover. Next slide. ACEs Aware has done a lot around distress and adversity and increasingly also thinking about strengths, and HOPE is really focusing on strengths and integrating it. Next slide. So what we're doing with them and with others is developing things like case conference guides, where in addition to finding out what the problem is, like what the distress is, right? And finding out what happened to you, we also use the building blocks to ask about things like, when did things go right for you, even for 5 minutes? What were the relationships? What was the environment like for you at that time? Who were you engaged with? What were you engaged with? That helps us do this. So, for example, if children who end up in separated from the biological families from the child welfare system, we know that relationships and engagement are important. So if a young person has a relationship with their aunt or uncle or grandparent, having those relationships preserved, if they're engaged, they're a gymnast or a swimmer or a singer, having them stay engaged in that activity that values them for their talents can be incredibly important as they go through through this process. Next slide. So the way we think about it is we do a case summary based on triads. Adversity is what happened to you in the past. Distress is what's going on now. What's wrong? What's the issue? Why are you getting care? And strengths are, what do you have already and what can we build on and reinforce to help alleviate the distress and help answer some of the damage that was caused by the adversity? And so for treatment, these things are all so interrelated that we work with the CDC, and they're people who've worked on ACEs for a long time and developed a lot of the data about the effect of ACEs. And now Phyllis Nylon, who leads that group, says, we really can't talk about ACEs anymore without also talking about positive childhood experiences, because the totality of the experiences we have is so important. And I want to just say on the next slide, you know, we always say that like people are like a tree, right? You look at a tree and you can see like maybe lightning struck or maybe a deer ate a branch or something. So there are scars on tree trunks. But really, trees grow up in communities. And these are giant sequoias. This is from Point Reyes, just north of San Francisco. And these trees are wicked tall, but they have very shallow roots. And the way they stand is the roots are all interwoven. So if there's a storm and it tries to knock over a tree, it can't knock it over, not because that one tree has deep roots, but because all of those trees are supporting each other. And I'm so delighted to be here at the coalition meeting because you're really exemplifying the web of supports that people need. And next slide. So how do you branch out? And that's what the rest of today is going to be about. So I want to skip a little bit to the next slide and talk about what's happening the rest of the day. But before I do, HOPE is a constant quality improvement project. So we love your feedback on what we're doing. And so if you wouldn't mind using this QR code, fill out the evaluation and let us know what works, what doesn't, so we can be doing better in the future. On the next slide, whoops, spreading hope, next slide. There are going to be team sessions. And for facilitators, we're now putting the facilitation guide in the chat. Most of you have already seen it. And it's like the graphic on this slide. There'll be time to reflect on the keynote and what you heard Alyssa and I talk about. There'll be time to think about practicing with helpful tools and planning. And the guide should help you walk through that. In the afternoon, your team will have time to come together and continue working on a different area of the guide. Similar to the morning, your group may have a different set of needs. If you don't want to use the guide, that's fine. The time is yours. And I want to thank you for your attention, for inviting me, for introducing me to Alyssa, and the honor of just chatting with her, with you, both beforehand and during this talk. And I'm going to turn it back to Sarah to finish out this session. Okay, I love the clapping hands. Thank you.
Thank you so much, Dr. Sege, and also to Alyssa. We really, really appreciate all the wonderful conversation, information. It's been incredible planning with you both, and really excited to have sort of positive frame come into the California work even more. So thank you. Well, I'm going to go to the next slide, Nathaniel, whenever you're ready. Great, thank you. So we're going to talk a little bit about the next couple hours. So from 10:30 to 12, you're going to get into your first team sessions. And again, that's kind of moving from that head to heart piece. If your team is fully in person, you can keep this main session open or leave the session and return when it's time for the afternoon presentation piece. If your team is virtual or hybrid, you'll return to the Whova dashboard via that open browser, go to agenda, and then sessions, and you'll click on your county Zoom session. A multi-county virtual room is available, and of course optional, for people whose prevention teams might not be participating today, or if you support multiple counties or you're a statewide provider, you're welcome to join that room. So you just return to the dashboard, to that open browser, you'll look at agenda and sessions, kind of similar to how you got into the workshops yesterday, and you'll be able to find the multi-county virtual room. For site leads and facilitators, as Dr. Sege mentioned, the facilitation guide is in the chat, and I know we've had a chance to kind of review that with most folks. So after your morning session, those 90 minutes is finished, you'll then take your lunch. So, however your group would like to do. And then you'll come back at 1 o'clock. And as I mentioned earlier, you'll hear from some of your peers from El Dorado and Tulare County. And that'll be about 30 minutes or so. And just some reminders for any tech issues, the Whova chat main session is where you should go. Site leads or facilitators, please place any questions around FF Family First Prevention Services Act, this comprehensive prevention plans, HOPE framework in the Zoom Q&A while you're in your sessions throughout the day. And everybody please return back here at 1 o'clock where we'll get started with our afternoon session. Thank you so much.
Thank you all. I'm typing a few answers into the Q&A so you can see them.
Oh, great. Thank you. Well, hello, everyone. Welcome back. Hope you all had a nice and restful lunch. We are going to get started with our afternoon activities and afternoon sessions. Oh, sorry, Aisel. We're going to get started with our afternoon activities and afternoon sessions in just a few moments. But first, we'd like to know, how are you all feeling right now? So next slide, please. There we go. All right, so what we'd like you to do is, this is a little fun Mentimeter temperature check. How are you currently feeling after your morning session and after lunch? So if you can scan the QR code there, or I believe the team is going to drop it in the chat. And please tell us on the 1 to 9 scale here, these very cute dogs, tell us, how are you feeling? You've got, let's see, overwhelmed, a little sad, full from lunch, sleepy, checked out, grateful, shocked, exhausted, and peaceful. Let's take a minute and tell us how you're feeling after lunch and after your morning session. Oh, thank you, Bryn. Oh, I see a lot of peaceful. That's nice. Grateful, sleepy from lunch. I think grateful might be taking the lead, followed by peaceful and sleepy. Thanks everyone for doing this. It's just a fun activity you can use with your groups to kind of temperature check as you're transitioning into. Okay, well, continue to fill that out if you haven't already. Looks like we've got a group full of grateful folks, and I am grateful to be here as well. So one thing we're going to do now is hear from our peers who've been meeting this morning and doing some work around a variety of different things. And I get to pass off to the lovely Barb, who's been supporting El Dorado County. Hi, Barb.
Hi, all. That's not El Dorado County down there, but that's a bigger group than I have.
I think
so. If
think
you want to, hopefully you'll fun. Okay.
Barb, it's a little
hopefully
hard to hear you. I don't know if that's just me. It might be your mic.
How's that better?
At least for me, it's about the same.
Testing.
From the interpreter, can you try turning it up a little bit? The volume?
How's that? Can you hear me now? No?
About this, I can hear you just a little bit low.
It's about, yeah, it's a little bit low, a little bit the same. But
how's that? Any better? No?
About the same.
Here, let me try without. Testing. Is that any better?
That's a little better. That's a little better. Mm-hmm.
All right, well, I hope you are able to locate El Dorado. They should be logging in. But I'll give you just a general overview of some of the highlights. We had a really powerful discussion about not only what they learned from this morning. Oh, there's my friends at El Dorado, yay. Not only what we learned this morning from the HOPE framework discussion, but also about what we took from yesterday's, because there were some really excellent presentations yesterday, and how that could move the prevention work forward in the county. So I'm going to share just a few overall highlights, and then I want to turn it over to my colleagues in El Dorado County because they had some really excellent points to make. So one of the things that we discussed was moving from ACEs to positive childhood experiences to HOPE is something that we think we would be able to integrate into El Dorado County's ACEs work. El Dorado County had an ACEs collaborative. It lost funding. We had a big discussion about what type of screening is going on now. It focused a lot on public awareness, but one of the things that we discussed is how the HOPE framework could help us kind of reinvigorate the ACEs collaborative work. We talked about the need to take a look at the evidence-based practices that we have currently in the comprehensive prevention plan, because we have a selection, based on 2 years ago at this point. But one of the things that we looked at was, do we need to expand some cross-cutting EVPs? We have motivational interviewing currently, but after yesterday's presentation about community behavioral health programs, thinking maybe we might want to look at something like multi-systemic therapy, but the idea being, re-examine some of those programs. One of our candidate groups, or two of our candidate groups, are families with substance use disorder and infants exposed to substance use disorder. And so we had a very open discussion about the need for inpatient substance use treatment in the county. We lost our provider years ago. We're trying to rebuild. It's a real need in the county. So that's something that we talked about. And the Shields for Families model was a real inspiration. I had my own personal plug about child family team meetings. I'm a CASA in my community, and I know that particularly the teenagers that participate in these team meetings dread them many times. So one of my plugs was, how can we think about utilizing some of the HOPE framework to make those a little bit easier and improve the experience for the children and families that have to participate in those meetings. First Five noted that they're currently working on their 25 through 28 strategic plan, and they're already building in a lot of the HOPE framework pieces. For example, supportive relationships with adults, and engaging the voice of lived experts. And one of our other participants talked about the need to bring back community events. A lot were lost during COVID. And one of the things that was mentioned was a kids expo. So those are just some of the things that we talked about. We had a great discussion, and I'm going to turn it over to the folks in the room in Placerville for more of their insights.
Good afternoon. This is Leslie with El Dorado. And I represent child welfare at the table. And one of the things, or a couple of the things we talked about with the HOPE model was just the alignment with some of the different child welfare initiatives. So in El Dorado, we are a safety organized practice county. And so I was struck by the similarity with the 3 questions in SOP, right? And we focus on what's working well, what are we worried about, and then what are the action steps. So that aligned with some of the conversation around the HOPE model. The other thing in child welfare, right, we're going through the new, we will anticipate the new foster care rate structure. And so one of the components of the new rate structure will be that strengths building component. And so I think that also coincides nicely with the HOPE model of, building on the strengths, building the different positive experiences, the relationships for kids as they play sports or they get involved in different activities. So I think in the room, we thought that there was a nice complement to what's happening in the child welfare world.
My name is Barry. I'm with a community-based provider here in Placerville. I just kind of building on that, I was encouraged hearing how the HOPE model blends with the integrated core practice model. That seems pretty encouraging because so much of what we do in child welfare and in mental health, is based on the ICPM. Also, just with the use of the CANs being so important in both worlds of behavioral health and child welfare. But it's such a large document and parents can be overwhelmed by the 62 measures. Looking at the PCE scores, perhaps those breaking it down into 7 questions might be a little less overwhelming for parents and for kids as they walk out going, looking at some smaller pieces of data. Was encouraging as well.
And then lastly, my name is Deanna Santana. I'm with the El Dorado County Commission for Youth and Families, which is a newer commission that's focused on systems integration and change so that barriers are removed for our families seeking services. And we are in the process of developing an outcomes-based report, which is going to be called the LIFT Insights for Youth and Children in El Dorado, or Youth and Families in El Dorado County. But we've been really looking at community-based outcomes that we want for our kids, and we were looking at developmental assets. So I see that we could use the HOPE building blocks potentially to help us frame some of that work, and then ultimately get into recommendations for our agencies and community on initiatives we could champion.
My name is Margaret Lewis. I'm the homeless youth coordinator, foster youth services coordinating program advisor, and SARB here in the county. And I talked about the HOPE model. I was involved in the ACEs movement very early on through kind of when it fizzled out. And I've been recently readdressing ACEs and kind of doing some training around ACEs to PACEs, we called it, moving from trauma informed to trauma resiliency. And the HOPE model really brought me to a point. I actually have a slide from the HOPE documentation in this program that I've done. But one of the things that brings me to be mindful of is Dr. Gabor Mate's work also, which is on trauma. The Myth of Normal is the book I'm drawing this from. But he says trauma is not the event that inflicted the wound. It is the wound that people sustain as a result of the event. And so the good news in that for me that's very aligned with HOPE is that wounds can be healed. And so they may not go away, you may have scarring, but they can be healed where the event persists. So a nice tie into the HOPE framework.
Thank you all. And those are our highlights from El Dorado County. Thanks, folks in Placerville.
Yes, thank you, Placerville. Thank you, Barb. Wonderful. I think we are going to hear from Tulare County next. And that's Lydia.
Can you hear us?
Oh,
Hello?
Hi, Lydia. Hello.
Hi. This is an amazing group of people.
Come closer. It's a little hard to hear you.
Can you hear me?
Much better.
Okay. This is an amazing group of people.
Oh, we lost you.
Oh no. Hello.
Is there a mic available or?
No, I'm sorry. This is
Oh.
like we're having some technical issues.
We can hear you now.
Okay. So this group is an amazing individuals who are doing some really transformative prevention work. And I just wanted to highlight that. This is our bragging moment. But today the discussions were really fruitful around not just what services can be provided to families to uplift the HOPE framework, but also the ways in which the relationships across the county can help elevate these things. So we did talk a lot about how do we leverage relationships and collaborate in the work, both at a systems level and then these like interagency personal level. And I'm going to hand it over to Mireya and Naya from Tulare County.
Hello, so my name is Mireya Anaya, and I'm the Division Manager for Child Welfare Services here in Tulare County. So kind of just adding in regards to what Lydia.
Mireya, it's hard to hear you if you can hear us.
All right, how about now?
Not quite yet.
I think the interpreter speaking, I think you need to be facing the mic. And I know that is contrary because you have an audience there.
Yeah, does this sound better?
Yes, much better.
Yes, okay. All right, I'm talking into the computer, into the laptop. So we were talking about the 4 building blocks of HOPE and bringing areas where we here in Tulare County can build upon that. And we also went into, talking about leaning into resources that we haven't integrated before. And relationships are very important, and they're a part of leaning into that. One of the other things that we talked about was being poverty informed and how that is going to lead us into the implementation of moving from mandated reporting to community supporting, because it's very important to identify the fact that because somebody lives in poverty.
Losing you, Mireya.
Better?
Sorry, we were losing you. Say again.
Can you hear me?
Now we can.
Okay. There's like a specific spot on here. So we were just talking about, being poverty informed, because we are moving from mandated reporting to community supporting, and how that's going to be crucial in the work that we do with bringing that into Tulare County. And that was all.
Is there anything as a whole you'd like to share about your prevention work in Tulare? I know you guys have been working really hard and doing some great things.
There you go. Yeah. Can you hear me now?
I keep going. I think so.
Okay. So yeah, when it comes to comprehensive prevention.
No.
Nope.
You have to talk about the phone like right here.
Okay, how's that?
Yes.
Yeah. Okay. So when it comes to talking about our comprehensive prevention plan, you know, we've been working with our CBOs and our partners in bringing forth Family Checkup, which is a program that we've been working towards with the families here in Tulare County. So we've been doing that. We've also been doing the Family Nurse Partnership program for the teens that we have here. One of the things that we identified on working with our comprehensive prevention plan was the gaps that we have here in Tulare County. And one of the biggest gaps that we noticed is we didn't have very many services for our older youth population from like 5 years to 17 years old. So one of the things that we really focused on is how can we bridge that gap and incorporate resources or services that, you know, were evidence-based practices into our CPP. Also, we also have Healthy Families America as well too. All right. Thank you. That's all we have.
Thank you, Lydia. Thank you, Minea. Much appreciated. So we're a little bit ahead of schedule, and that is all right. It'll just give your teams a little more time in person. And if you do have any questions for El Dorado or Tulare, please put them in the Q&A, and we're happy to get those questions out to them and be able to send the responses out to the group via Whova. So what we're going to do now is now that you've had the morning to kind of think about the HOPE framework, and maybe if you use the activities, it's kind of more on an individual or family level. So we're going to move to thinking about your county's development and implementation of community pathways and how the HOPE framework enhances and aligns with your current efforts. So from there, let's see, thank you. So our next slide, I'll tell you a little bit about our afternoon. So as I said, we're a little bit ahead of schedule, and that's all right. That'll just give you all some more time for good discussion. So we'll be thinking about applying HOPE and planning for action. So if your team's fully in person, you're welcome to keep this main session open still, or you can leave and come back. If your team is virtual or hybrid, you return to the Whova dashboard, go to the browser, agenda, and sessions, so like you've been doing already. There is, again, a multi-county room available for folks whose teams may not be participating today, or if you're a statewide provider or you might support multiple counties, feel free to join that room. And again, that'll be via agenda and sessions. We'll come back at about 3:20 and we'll hear from Santa Clara and Lake counties. And then we will kind of do some reminders and wrap up. So it's about 1:20 right now. We will see you back at 3:20 p.m. Thank you, everyone.
And Sarah, I just want to note that we dropped our day 2 evaluation in the chat a little early, just in case some people have to hop off before our closing and before we come back.
That's great. Thank you so much, Bryn. Yes, if folks can please fill that out. If your day happens to be ending a little bit early, we greatly appreciate it. It'll also get sent out with additional materials at the end. Thank you. Hi, everyone. Welcome back. I'm going to wait till our ASL translators come on and then I'll get started. Oh, hello. Thank you. All right. Well, welcome back. Hope you had a really insightful and great conversation in your second session. I know you had a little bit more time, so hopefully that allowed for kind of a deeper dive into some of the topics. And yeah, looking forward to hearing about some of the progress. So we are now going to hear from 2 counties, Santa Clara and Lake. And I believe we will speak with Patty and Rocio. So, hi, Rocio.
All right. Hello. Can you hear me?
Yes.
Okay. And I'm going to try to share. So I'm hoping that my permission went through. Looks like it did. So we had a super exciting conversation. And we kind of veered a little bit off topic, but it was good. It was important that we did because there were some really good things that were shared. Are you able to see my screen?
Yes.
Okay, perfect. You can see the stickies.
Yes,
Somebody
there's
give me a thumbs up. Okay, thank you. Thank you, Mr. Interpreter. So what we did for our afternoon was a little bit different than the suggested agenda. We did start off by talking about hope and what that means for our county. And I'm going to get into a little bit what that conversation looked like. But the gist of our conversation was not so much about hope, but around what we are doing as a county, what we said we were going to do, what we've been doing, and what shifts we want to make. And there was a really good organic conversation that came out of that latter part, and that's where we're going to spend most of my time. But I just wanted to show you, we did a total of, I think, 3 breakout groups. The first one was really processing around the HOPE framework that was shared. And we asked, you know, what are we already doing as a team and or as an individual to promote the positive childhood experiences? And then our second question was, what strengths-based approaches are we currently offering to support PCEs? And so you can see we had a rich discussion, we had breakouts, and then people charted their comments. And so none of this should really be surprising. I think that PCEs is very aligned with how child welfare works and how many of our partners work. We already do assessments where we focus on creating supports for the families and helping them identify a circle of support so that they have someone to fall on when times get rough. There was a lot of conversation about trust building and the importance of humility and authentic conversations with our families and our youth in order to build trust. And that trust sometimes can take not just 1 or 2 sessions where you're assessing, but it can even take an entire year where you can make an impact on them. And that we need to take time to build trust. Around the strengths-based approach, now I don't expect you to be able to read this. I just wanted you to see that there was a lot of discussion. There was a lot of discussion around sharing the resources that we all have with our families, but also knowing that there's a lot of resources we may not know about and we need to learn about. Letting families take the lead. They are the authors of their plan. We're really there as facilitators to help them and to connect them to resources. And we also felt that a strength approach of ours is really the focus on prevention. The next question I'm not going to go through, just to let you know that we talked about similarities and differences of the HOPE model compared to ICPM. So our notes are there. Oh, sorry, I keep trying to get this thing to go. What I really wanted to focus on is, where is it? Should be the next question, sorry. Bear with me. There we go. Oh my Lord. This is kind of a clunky platform. Okay. So then we jumped into the discussion about ICPM and how our work interfaces with HOPE and ICPM, how they're linked together. And really what I wanted to talk about is what organically came out of this conversation is really about, again, relationship building and trust is really not between just one person and another. It's really a system of trust that we have to build, that we have to have the safe space to be able to talk to each other, and even just having the space to get to know each other. We talked about in that system possibly doing a crosswalk of the tools that were offered today out of the HOPE framework with the existing tools that we use. We were all in agreement that we do not want to implement a new framework. We think we'd kill everybody if we try to implement a new framework because we're very much in alignment with what was shared earlier. But we can use the opportunity of sharing the tools that were shared with us to see if there's anything that we should modify in our existing tools and frameworks. There was an interesting comment that said that we have to frame our conversation on hope and getting to where youth and families want to be, even if they can't envision it yet. How do we stick with them and help them get to where we believe they can be and where they believe that they can be? So it takes time. It's not something that happens overnight. We also talked about being aware of challenges because this work is very difficult, and we all know that turnover is great. And not only does that have an impact on the system, it has an impact on the families when they have to switch from one social worker to another, one therapist to another. And so how do we address that? We acknowledge that we need to go slow to go fast, that we often throw out initiatives and it becomes initiative overload. We never really complete one when we're on to the next. And so how do we make sure that we're intentional about what we do and slow down? And how do we hold each other accountable to what we say we're going to do? So for instance, with our child and family practice model, which is now blended with the integrated core practice model, how do we hold our social workers accountable to upholding those values with the families? That's not easy work. We DFCS is going to be doing a survey, but that's just one of many strategies to make sure that families can say we are on target on doing things the way we say we will versus maybe missing the mark, and what can we learn from that? And then the last theme, so we talked about a system of trust, and then we talked about challenges. The last theme is what can we do to support each other? And so we already, as our Families First Collaborative, meet on a quarterly basis where we give our stakeholders updates on where we are. And so there was a suggestion of using that platform to give the CBOs a place to share what they're doing, but to be very intentional in talking about our 4 target audiences that we've identified for Families First, and then talk about how we're serving each of those 4 target audiences. So one session could be pregnant parenting teens, the next session could be substance abusing families, but that we're very intentional about inviting speakers that are addressing those families, what they're doing to support those families, and maybe organically identifying where the gaps might be. So we're actually out of that discussion really seriously considering restructuring that meeting and or any other meetings within the county to be able to give the space for our CBOs to build relationships with each other. Santa Clara County is resource rich, but we don't always know what resources are out there because they're ever changing or how to navigate them. So if we don't know that as community serving folks, how can we expect the community to know that? So we've made the commitment to kind of learn about each other and get deeper. In other words, go slow, learn, build relationships amongst each other before we jump off into providing new programs. And so it's about creating a culture shift. We're part of that. It's not just families. Families do this, families do that, you do this. It's about all of us reflecting on what we're doing, how we're upholding HOPE, how we're upholding ICPM, and whatever other frameworks we have. Holding ourselves accountable and creating a system shift, knowing that it's across the board. Primary, secondary, tertiary, community, social workers, systems, it's all of us together. And then lastly, I just wanted to highlight that we're super excited that we were able to speak about some programs yesterday. Santa Clara County was able to speak about resilient family programs, which is through Sacred Heart, Santa Clara University, and child welfare. And then we didn't get to speak about parent cafes, but parent cafes is also a peer-led structure where they can informally meet with families and talk about protective factors. And then the third was about our SAFE program, strengthening all families equitably. And that is our community pathway, and we were able to showcase that. And the reason why I bring that up, number one, props to Santa Clara County for being able to do that. But more importantly, because when I heard the presentation, I felt like, well, we're really in alignment with this. We're already talking about protective factors, and protective factors, in my mind, is very much in alignment with HOPE. So we were able to share some of that, and certainly willing to have conversations with other folks beyond that. But it feels good to know that we're in alignment, and it's still good to pause and reflect. So I can probably share a lot more. I'm going to ask Patty, did I leave anything out, or any of our other facilitating partners?
I think the only thing I would highlight from what you shared, Rocio, is that during conversation, it felt like you know, hope is the evolution, you know, that it's now hope, the antidote to ACEs and all the work that we've been doing locally in regards to trauma, being trauma informed. And, you know, how do we really relive that and bring it back up to everybody's attention and hold it in even more and evolve it to the next step.
Anybody else from Santa Clara County have a burning point that we forgot to mention? Because there was a lot. It was a really rich discussion and I felt really refreshed by it. And I felt like there was some refreshed ownership and buy-in on this process. So I felt really enlightened by it. Anything else that anyone wants to share that maybe I forgot? Okay, props to Santa Clara County.
You're welcome to put it in the chat too, in the Hoova chat, Santa Clara folks.
Sounds good.
Yeah, they're welcome to share there. I really liked 2 of the pieces you guys shared. So what can we do to support each other? I think that's a huge, really important question because this work is not easy and it is relational, right? So I think that's a really key question, and go slow to go fast. It's so true. We know it, right? It's hard to do, but absolutely. Thank you, Rocio. Thank you, Patty. That was really insightful.
You're welcome.
And folks,
thanks for the opportunity.
Absolutely. If folks have questions for Santa Clara, please put them in the Q&A, and we can always get those questions to Patty and Rocio after the event today. Thank you. All right, I will pass next to Lake County. Then we'll have Lucy Hernandez with us. And Lucy, I'm not sure if you're presenting, if it's just you or maybe somebody else from Lake as well.
Kevin from Probation will be presenting on behalf of Lake County.
Wonderful, take it away.
Perfect. Well, in hearing Santa Clara say they're resource rich, I think one of the strengths we have here is this team behind me here. We are rich with this team, and to brag about us, there was more here this morning. So we have a lot of people dedicated to this work. We also kind of did a different approach this afternoon. We were talking about our CPP goals, and we wanted to highlight something that we've discovered that's been successful for us, and however that may help other counties. We're happy to share it with you. I'm not going to go over all 4 of our goals, but I want to highlight one of our goals in particular, which has to do with enhancing our relationships with the local tribal communities. That goal is embedded in each of the other 3 goals, but I want to highlight that here in Lake County, it's been something that the team behind me and those who have spent years working on the CPP plan, we've noticed it as an ongoing challenge for quite some time. And we had a fantastic discussion about some of the ways we've seen this improve in a relatively short time, I would say. And so one of the ways, or some of the ways that that's happened is we've noticed that things started to improve when we not only, you know what, one of my partners here who's far more concise than I wrote this down, and I think it articulates it so well. We took the time to not just invite our local tribes to our table, but to visit their table and see the work in community building that they do, so that we may support their efforts, not them supporting ours. And really what that's looked like is we've discovered that some of our local tribes are doing such amazing things with their local resources where they're ready to benefit the community. It wasn't about any of us coming in and trying to take what they do or change what they do or take over what's going on. They were just waiting for us to partner with them. And I can tell you that some of the conversations between, there's many agencies in this room, some of the conversations that have taken place over the last few months have just shown that we as Lake County are stronger together. It's not just our children's council, it's not just the tribes, it's not just probation or child welfare or First Five or behavioral health, but we, Lake County, are stronger together. And the biggest example that we recently saw is at a stakeholder meeting last week. We noticed that where we previously would have had maybe one or no representatives from those tribal communities, we had no less than 5 different tribes or tribal organizations come to that event, not because we just reached out and said, hey, you should come here, but because we've been doing work together over the last months where our different organizations have been invited into the programs that they're doing. Some of our tribes have after school programs that my department's been invited to, that behavioral health's been invited to, and we haven't come in with a curriculum or expectations. We've come in prepared to learn, prepared to be able to help in whatever way we can help and support what they're already doing. And what we've learned is, boy, do they have a lot of good stuff going on, stuff that we didn't even know about, stuff that they're doing better than maybe we were doing beforehand. And so I just think it really speaks to if a county such as our size here in Lake County, and I know many of you probably don't even know where we are. We're like an hour north and an hour west of Sacramento. But if it can happen here, it can happen anywhere. And I can't speak enough to the partnerships in this room, the partnerships from our tribal communities, all of which who are committed to making this better. And it's better for not just a group, but it's better for children. It's better for families. It's better for Lake County. And because of that, Lake County is stronger for it. And because this is not, again, I just have to shout out the team behind me. What a fantastic conversation that we've had today. What a fantastic time together. So we thank y'all for putting this on, and what good work that all of these counties are doing. So for all of us, let's keep it up because these kids and families deserve it.
Very well said. Very well said. Thank you so much, Lake County. I really appreciated, so many bits that you gave us, but in terms of working with your tribal communities, visiting their table, right? They don't need to come to yours, but how can you build a relationship to potentially go to theirs and then support what they're already doing, right? They know their community best. They know their families best. Support what they're already doing. I really appreciate that. That's wonderful, wonderful information. And I think really important for everyone to hear. We do have a couple of additional minutes. So if anyone has questions for Lake or for Santa Clara, we could take a few questions. If you put them in the Q&A, we'll give a second or two for folks to do that. And it looks like you had a great, I was so excited to hear that you all had such great discussions today. It's really wonderful. That was the hope. I see we have a hand raised, but I don't know if it's possible to put if you have a question, to put it in the Q&A box. Somebody, early explorers. Not sure. Oh, wait. Never mind. Okay, let's see. We have not a question, but there's a new tribal liaison with DDS that's looking to connect with more people working with the tribal communities and the communities themselves. That's very good to know. If you happen to have a contact or a way for folks to contact you to connect, please feel free to put that in the Q&A. He works on Service Access and Equity Division. All right, that's great. Yes, if you have a contact, oh, there we go. So if folks can see that in the Q&A, we'll just I think you all can see the Q&A as well. For Santa Clara, what was the mix of folks who participated in your work today? For Theo or Patty?
Yeah, I think it changed throughout the day. But I think in large part, we had a lot of community-based organizations. Normally, it's a lot of county folks, but it was very different today. And I think that's why the conversation was very different. So I don't know, Patty, do you agree with that or?
Yes.
Okay, yeah.
I have a quick follow-up. Why do you think that was today, that you had more community-based organizations as opposed to local government folks?
I would defer to the group, but it's hard for me to say. I know for government, there was a lot going on today, including a board meeting. So that influenced some people's ability to come, but it would be good to hear from the participants why they came today, because we did have some new folks that we had not seen before. So unless Patty, you have an answer.
I can theorize, but I, you know, based on what we heard today, I think people getting the announcement and being now in the expanded listserv that we've been creating has helped to get the word out to our community partners.
Right, your network is building and growing. Yeah, fabulous. Any more questions for Lake or Santa Clara? And team, I don't know if in the Hoover chat there's been any put in there. If not, okay too. All right, well, thank you everyone. If we get any additional questions, we'll definitely reach out. And Nathaniel, whenever you're ready. All right, I have the joy and honor of wrapping us up today after what sounds like so many fruitful and wonderful conversations. Thank you to all the counties who are willing to present today. And I know sometimes the audio and tech can be challenging, but you did it. And we want to share a few resources about things that are coming up that we hope you will be interested in and want to be a part of. So, all right, when that slide comes up, thank you. Okay, so here's a couple of events statewide coming up. We have Strategies Technical Assistance is hosting our third webinar in a series called Taking a More Holistic Approach to Community Pathways. And we're going to be looking at building community collective capacities for community-led change. And that's going to be on May 22nd. It's a webinar and you can register there. I think the team will put the link into the chat. For Caltrin, you have a number of different upcoming trainings. I won't read them all off, but they have a great calendar and you'll be able to go to their site and check those out. The Child Abuse Prevention Center and the Office of Child Abuse Prevention are doing a series of webinars in April called It Takes a Village webinar series. And those will be, I believe, every Wednesday at 11 a.m. And they'll have a registration flyer coming very soon. We also learned about the Office of the Surgeon General will have a webinar coming up. It looks like there's 3 dates, March 5th, April 2nd, and May 7th. Strong Start and Beyond, Partnering for Progress. And we'll drop that link in as well. Our partners, Child and Family Policy Institute of California, it looks like has some advisory, FFPS advisory recruitment announcement happening. So I believe there's a link there the team can put in. And Kids and Families Together, a parent support group that's held on Monday nights from 3 to 5 in English, Tuesdays 4 to 5 in Spanish. And Janelle's information is listed there. Janelle was one of our planning team members. So thank you so much, Janelle, for putting that resource up for everyone. And next slide. All right. It just feels so incredible that we actually found some dates that work for next year. At least we're hoping for the vast majority. The planning team felt like we weren't crossing any major other events or things happening. So March 18th and 19th of 2026, if you can believe it. Save those dates. We'll have more information to come out. I think we had almost 1,800 people registered for these last 2 days, which is by far the largest amount of registrants we have ever had, which is incredible. We actually had to up some of our thresholds for taking folks because we capped out. So we had to increase those. And I just think that's a wonderful, incredible thing to have to do. It was a great problem to have. So thank you, planning team, just for thinking about the vision even for next year. And I can tell you in our last planning team meeting, folks were excited to start planning already for next year. So there's a lot of good energy and I think a lot of desire to really bring helpful and useful information to the field. And I really, really appreciate that from our wonderful group of planners. All right. So next slide when you get a chance. So thank you all so much for attending day 2 of the 2025 Statewide Collaborative Prevention Convening. We really value your feedback. We really value your time and want to hear from you so we can make this event even better next year. So you can scan the QR code, or I think they're dropping a link in as well. And before I wrap up today, I'd also like to send a great big thank you to the strategies, tech, and production team who are behind the scenes today. They made so many amazing things happen over these last 2 days. I'm just so incredibly proud and thankful. So thank you so much, strategies team, for all the hard work. You guys did incredible. And it wraps up our annual convening. Thank you all so much, and we're wishing you a wonderful Friday tomorrow and weekend. And please let us know if we can help with anything that you all have coming up. Really appreciate your time. And here are some additional resources, links, and contact information if anybody kind of needs some more information on FFPS, Caltrans strategies, or the CalPrevent Statewide Connect. All right, have a great day and safe travels, everyone. Oh.